communities and so I just wanted to thank everyone, including our cabinet. We would like to promote further interaction and collaboration between PAPANA and PPS and other organizations in promoting research and teaching in psychiatry. I actually I was thinking about this morning. I think I'm proposing to develop an electronic calendar which actually can organize, the people visiting from Pakistan. They can learn from their experience, and people from United States visiting, actually Pakistan visiting United States, so that we can benefit from their experience, and also people from the United States visiting Pakistan, so they can, we can share our expertise. Um, and so that is something which, we can, it's a low hanging fruit to organize those activities, although we already do those. And so just wanted to give an update on some of the things which we have accomplished. And I think Fauzia can give you an exact number of how many abstracts we have submitted in various national, international meetings. We have done a lot. I cannot recall the correct number, but I think we really need to have a little bit more cooperation and collaboration with you guys in Pakistan. And I think we actually, just to update you, we recently completed a couple of surveys in Pakistan, and one paper has already been submitted for publication. So we can collaborate further with other people. And I'm also trying to collaborate especially with Dr. Hashmi. We submitted a couple of research grants, but unfortunately we didn't get the funding. But I think that was the first step, and we'll continue to work on those lines. One of the thing I think PPS, and if we can be of any help to PPS as PAPANA, is, this is highly ambitious goal, but if we initiate something positive that can help our psychiatric patients and the practitioners over there, is to start thinking about, not prescribing psychotropic medications without the psychiatrist or physician scripts. That is a very long desire for me, and I have always thought about that if we can do that, that will be awesome. Thank you so much, and I will give back to Dr. Ahmed Rehan. Thank you.
Thank you, Dr. Shad. I would like to invite our General Secretary, Dr. Zishan. Over to you, Dr. Zishan.
No, thank you so much, Mujib bhai, for leading us. I know the PAPANA has been for so many years. You have been leading the organization and keeping the organization work and flow. So we really appreciate your time and efforts. And today I just want to acknowledge and appreciate a lot of our leaders from Pakistan, who were able to join us even on such a short notice. Most of them are teachers, mentors, and supervisors to many of us, even in the PAPANA in the cabinet. So really thankful for Dr. Bakar, Azeem, Professor Dr. Imtiaz Dogar, Professor Dr. Ali Madi Hashmi, Professor Dr. Nazish, Dr. Aisha Mia, and so many others who were able to join on such a short notice. And also as well as my cabinet, who worked really hard on such a short notice for the flyer and working to make sure that we can have this collaborative work. So on that note, as Dr. Mujib mentioned, that we have been working on a couple of things, but in the past couple of months, one of our main goal is to help our residency applicants specifically, because this is a match season. So we have provided them with a mentorship in terms of their application, their personal statement, and now going into the mock interview to make sure that we are helping them, making them aware how to be successful during their residency application journey. Along with that, we are also planning to start something for our own residency applicant and even early career psychiatrists to provide some mentorship platform for them. And for that, we will soon be requesting our mentors to to join us in providing the mentorship. And we really value our collaboration with Pakistan Psychiatric Society. I mean, we feel really honored to work with all of you. I think all of you are, as I mentioned, teachers, experienced experts in the field, and working with you, working with all of you, learning from you and collaborating from you. I think it's a great honor, privilege, and an opportunity for most of us in the cabinet who are pretty young in the career. They not only look young, but they are actually young in terms of their experience. So we really value, your leadership and this collaboration work. And along with that, I thankful everyone who were able to join again on the short notice. I know we have Dr. Sadiq Naveed and many other experts, both in US and Pakistan. And with that, I would like Dr. Manal Khan to invite our speakers. Thank you.
Thank you, Dr. Zishan. I would like to start, I was about to say evening, but it's night in Pakistan, by inviting one of my mentors, Dr. Ali Hashmi, who is a tenured professor at King Edward Medical University, who runs a very good psychiatry department at Mayo Hospital. He did his residency from Baylor, Houston, worked as a community psychiatrist in Arkansas for about 8 to 10 years. And then in 2010, 2011, he returned to Pakistan. And I think since then, he has never looked back. He has been helping psychiatry applicants, patients, students all over. Currently, I'm in Pakistan and I have visited his office a couple of times, and his office is always full of students and residents. They are always discussing something, seeking his guidance. So, and he's also, in regards to Pakistan Psychiatric Society, he's the president of Punjab part of Pakistan Psychiatric Society, if I'm not wrong. So I would like to welcome Dr. Ali Hashmi. Over to you, Dr. Hashmi.
Thank you, Dr. Ahmed Rehan. Can I just have a quick sound check? Is my sound okay? Can you hear me okay?
Yes.
Thank you, Dr. Ahmed. I am so happy to be speaking on this webinar. I apologize for sort of jumping the line. I requested Ahmed and Zishan to speak a little bit early. I may have to leave a little bit early. I had another commitment, but I will try to stay on as long as I can. First of all, let me welcome all our distinguished speakers. Our president, President of PPS, Professor Imtiaz Dogar Sahib is here. My very dear friend, Professor Bakar Azeem, Professor Nazish from our own department, of course, Professor Aisha Mia, who's a leading child psychiatrist of Pakistan, and also a friend in the US, my dear friend, Dr. Mujib Shah. We just worked on we've been working on some research collaborations. Zishan, you and Ahmed, Dr. Asif Khan, and Dr. Fauzia. So thank you all for inviting me. I won't take too much of your time. I'm representing the Punjab chapter of Pakistan Psychiatric Society, and we are extremely proud, delighted, in fact, to be in a close collaboration with PAPANA, and we've started working on some projects, and we hope to deepen that collaboration, to continue that collaboration. I'll just go ahead and in the next couple of minutes, I'll tell you a little bit about what the Punjab chapter is doing in terms of Pakistan Psychiatric Society, and Professor Togar, I'm sure, will talk about what we're doing nationally in terms of the psychiatric work that we're doing. So Dr. Mujib has already mentioned the psychiatric treatment guidelines for Pakistan, which we just recently launched at one of our national meetings. And we're very proud of those. These are the first of their kind practice guidelines for psychiatrists in Pakistan. We've got collaborators from all over the country, and so we have a nice mix of people talking about various illnesses, their treatment. We really envision this as a living document, something that we can upgrade over time, something that we can work on, continue to improve as time goes on. So that's one thing we're working on. We are working on sort of two ends of the spectrum in terms of psychiatric work. We are working on multiple pieces of legislation and policy with the federal government, with provincial governments. One example, for example, is the Mental Health Act, which has been something that we've been working on for a while, but has never been implemented. So we're in close contact with President Arif Alvi is a big supporter of psychiatric initiatives, mental health initiatives, Dr. Faisal Sultan. We're really fortunate that the current government has several people who are quite open to the idea of improving mental health services, improve funding for mental health services. So we are really working with them very actively to develop policy, develop legislation, both at the federal and the provincial level, that'll have far-reaching consequences for the delivery of mental health in Pakistan. Here in Punjab, we are very excited that we're going to be working with our health department, our primary and secondary health department, to begin trainings for general practitioners all over the Punjab. Professor Nazish and Dr. Dogar and all of us here in Punjab will be working with the health department, and we are now working on developing guidelines and trainings for general practitioners at primary care clinics and also well-woman clinics to screen for common non-communicable diseases, to really attempt for the first time, I think, in Pakistan, to provide good, high-quality mental health care at the primary care level all across the Punjab. And we hope to replicate the Punjab model across the country, and do that so that we can sort of move psychiatric care out of big academic medical centers and bring it down to sort of the grassroots level. Just very quickly, Dr. Mujib mentioned the issue of the psychiatric prescriptions, and people taking psychiatric medications without prescriptions, so on. We don't have any specific legislation on that. There is legislation that exists, but the problem in Pakistan, of course, is enforcement of legislation and laws that are already in the books. But rest assured, Dr. Mujib, that we also are concerned about those issues, not just about people having access to medications without prescription from doctors, but people being prescribed psychiatric medications without appropriate psychiatric expertise. And so, and we are working with different specialties, general practitioners, other specialties, academic centers, rural health centers, to really try and train non-psychiatrists in the use of basic psychiatric medications, so that they can do some basic interventions at a lower level. Because as you know, the number of psychiatrists in Pakistan is very, very limited. We only have a total of maybe 500 or less people all across the country. And even though most of us work in academic medical centers, and we do training, and we do we train the future generation of psychiatrists, but the overwhelming need for psychiatric services is such that it always sort of outpaces whatever we can do. So we really need to develop more of a primary care model of psychiatric services, which we're working on developing with both the federal and the provincial governments. At the end, what I just in the last few seconds, what I like to talk about is we would really love PAPANA's help in two main areas to help us further upgrade psychiatric services. One of those would be to give us some collaboration, give us some help in terms of upgrading our postgraduate training. So now with Skype and with the virtual trainings, we're fortunate to have people, young dynamic people like Dishan and Ahmed Rehan. Ahmed, in fact, has been coming to our department and working with our residents, and we've had some talks and training with them. But we'd really like to work more closely with PAPANA to work on some of that skill transfer from the US, psychiatric skill transfer from the US to our trainees here. And eventually, at some point, it would be wonderful if we could develop some rotation for our psychiatric postgraduate trainees, those who don't do residencies in the US, but would still benefit from, let's say, a 2 or 3 or 6 month rotation in the US as part of their psychiatric training in Pakistan, to give them some extra exposure to a different system of training in the US and add to their training experience. And of course, we would love to continue with research collaborations. Dr. Mujib and I are working on several projects, and Dr. Nazish, of course, is always working on different research projects. I know Dr. Bakar has worked closely with her. So we would really love for you to continue giving us your research expertise, give us some ideas about how we can take that forward. We have several exciting projects in Pakistan going on in terms of developing more research, better research, getting population level data in Pakistan about the illnesses here, because that's always been lacking. But we are working on that as within the constraints of the resource constraints that we have. But I'm very happy that we have such a young and dynamic leadership of PAPANA, people like Zishan, people like Dr. Asif and Dr. Fawzia and Ahmed Rehan, working under the leadership of Professor Mujib Shad and all of the office bearers and all the elected representatives of PAPANA. So we would love to continue working with you. Congratulations on the good work you're doing, and thank you for inviting us to speak here. Thank you.
Thanks a lot, Dr. Hashmi. A couple of things I would like to mention. So as Dr. Hashmi was saying about possibility of psychiatric residents in Pakistan going to US either for a whole year fellowship, and the other thing he was mentioning maybe for a couple of months just for some rotations. And a couple of months ago when myself and Dr. Zishan met with Dr. Hashmi in Orlando, we did discuss that, and I'm trying to work that out. I am trying to contact ACGME and APA, some of the other organizations, to see that how feasible is the process and how seamless we can go about it. So we are definitely working on it. I would also like to welcome Dr. Professor Bilkis Shabir. I think she's here, and I think she is from Internal Medicine Department of King Edward Medical University. Thanks, Dr. Shabir, for joining us.
You're most welcome.
Our next, thanks, Dr. Shabir, for joining us, means a lot for us. Next on our agenda, I would like to invite Dr. Imtiaz Dogar. He is a professor of psychiatry in Punjab Medical College, Elite Hospital, Faisalabad. He is the current president of Pakistan Psychiatric Society. One thing I have personally noticed, I would like to mention that I'm somewhat savvy about the social media, the Facebook, Instagram, Twitters, and stuff like that. And I've been noticing a significant increase in the number of posts by Pakistan Psychiatric Society and the quality of posts over at least past couple of years. And I think they have been uploading such wonderful videos and pictures and all of stuff. So I think that Pakistan Psychiatric Society has been doing a wonderful job. And actually this morning I was invited for an online session. And during that, I mentioned that Pakistan Psychiatric Society right now under the dynamic leadership of Professor Imtiaz Dogar is really working very, very hard, especially in terms of increasing awareness, which the whole world needs, especially Pakistan. So welcome, Dr. Dogar. Thanks for joining us.
Thank you. Assalamu alaikum ji. Bismillah ar-Rahman ar-Rahim. Thank you, Dr. Ahmed. And thank you, Professor Mujib and rest of the friends, Professor Bakar, and people from Pakistan, Dr. Zishan, Dr. Sadiq Naveed, and even Dr. Fawzia, all. So it's very good. We are very impressed to see the proactive role even of PAPANA for the people who are being inducted in psychiatry, the mentorship and guiding them. This is very, very important, very much desired and needed for our medical students. And that's highly, highly appreciable. Further, I want to talk about Professor Mujib has said collaboration. Collaboration is something between PAPANA and PPSA which we need to strengthen further. And he talked about electronic calendar of people visiting from both sides. That's really impressive. We shall go. And you talked about fellowship. Further, other than fellowship, it's more of collaborative research is one area where we can, there is a lot of space where we can excel, and there are a lot many people over here, lot many patients, but it's more of, and it's the previous collaboration with our Professor Bakar.
अमेरिका में ना डॉक्टर्स की वो हो रही है, साइकियाट्रिस्ट की ना कॉन्फ्रेंस, तो वो मेरे जानने वाले.
Excuse me, I request everyone to please mute yourself.
जी, Mike, please. Dr. Fawzia, जरा जोर से कहें, then people will understand. So collaboration in that aspect, collaborative research is needed. As far as Pakistan Psychiatric Society regarding its number, I must say it's about 550 members. There are almost 150 more psychiatrists. So it's 700, but still the gap is much higher. The treatment gap, and for 220 million population, much more number is required. So to fill the treatment gap, the model we have to follow as only a training of GPs and primary care physicians. Primary care physicians, we call those people who are working in government setup. For them, as Professor Ali mentioned, we are going to sign MOU with Punjab. And for people working in, you say, family physician in the private setup, the training has already been started from Psychiatric Society platform. We have done 2 courses over here. Professor Ali Burhan ran it at Rahim Yar Khan, or Moti Bhatia, the chapter chief of Sindh, did at Mithi and then at Swabi. and few courses on the pipeline in remote areas of Balochistan. So we have started training general physicians, doctors working in private setup to teach them, to train them management of psychiatric patients on priority disorders. That was one of the area. And along with that, we have got about 22 executives. They're everywhere, as I just mentioned. And some of the executives and other members, they are regularly arranging free psychiatric camps as well on monthly basis. Some of them like off and on. So the service to actually patient has been started. And you have, and Dr. Ahmed has mentioned about his role in social media. Our young and dynamic Ali Mufti, our information secretary, is working a lot on that aspect. And in fact, our new website is also going to be launched in a few days. And then there is upcoming event of Pakistan Psychiatric Society annual conference, which we're going to organize from 26th to 28th of November. Some of you are joining, others are requested to please join, and others even can submit their papers. We can have some of the online options for them. And then if we see, we have announced 4 research competitions over there. One for early career psychiatrists with heavy prizes, one for PG trainees or PG residents, one for medical students to attract them. And for them, we have included topics of psychiatry and behavioral sciences as well. And another one are for our colleagues, clinical psychologists. So 4 competitions we have announced. We're going to launch 2 guidelines, one for adults and one we received today. Bakar has sent, and in fact, the celebration has started with this on the day's mark. And we're going to organize these 2 in the form of book, and they'll be available free of cost for all members of Pakistan Psychiatric Society. So that will enhance their capacity to manage such cases. Of course, this is a dynamic thing, और उसमें there are rooms of improvement. Further होती रहेगी, इसमें improvement चीजें बेहतर होती रहेंगी. Regarding Psychiatric Society platform and people working in Pakistan psychiatry due to COVID and so many other situations, alarming number of patients, and there are a lot many strain on our people. But our people, our members, our psychiatric fraternity, mental health professionals, they are providing service. And today I was talking about in one of the webinar about myths and misconceptions. The area where we are practicing, still our patients, they feel a lot of discrimination. Abhi bhi unki wajuhat mein jinn, jadoo and saya and so many other things, weak willpower, and then punishment of sins is usually considered to be the factors. So in sab ke saath bhi hum sath kar rahe hain. And then of course still there are myths and misconceptions about treatment. दवाइयाँ गर्म हैं जी, and then सारी उम्र के लिए लग जाएंगी, और other factors associated with them, and then myths and misconceptions with ECT and rest of the things. But we're fighting it bravely, or alhamdulillah, all members are there providing our services. And then talking about our collaboration with governmental sector. The government has formed, federal government has formed a task force. And that task force for mental health is working in close collaboration with, of course, our National Health Department, Ministry of Health, it's NCD and mental health. And they have launched an action plan, one of the meeting I've attended. And then Pakistan Psychiatric Society has mentioned as a proactive step, we are going to sign, as Ali has mentioned, training at official level in all 4 provinces plus AJK and Gilgit-Baltistan. So the training has been started, alhamdulillah. We are going for publications, we are encouraging research, and collaborative research with PAPANA is going to be more milestone. And these are some of the things we are trying, or still we are fighting with stigma and myths and misconceptions. But alhamdulillah, things are going in right direction. Our cabinet is very vibrant, our members, they are very contributory sort of, and the society is progressing and providing services to the masses. We're working for positive mental health and the rest of the issues. And I hope the guideline for PAPANA and contributions for PAPANA is going to help us more and more. And Jazakallah for giving me this opportunity to talk to you and for arranging this. This is a very important meeting, I must say. Thank you. Allah Hafiz.
Thank you very much, Dr. Dogar, for this detailed note. We really feel excited about listening. All this is a first collaborative meeting, I would say, and we are really feeling very excited about it. And we will continue this activity, hopefully. So now, next, I would like to invite Professor Dr. Mohammad Bakar Azeem. He's an internationally recognized academician and healthcare leader and inaugural chair of psychiatry for Sidra Medicine in Doha, Qatar, professor of psychiatry at Weill Cornell Medicine, Cornell University, USA. He has played an instrumental role in establishing child, adolescent, and perinatal psychiatry services in Qatar from the scratch. Apart from this, Dr. Azeem has contributed nationally in number of important initiatives. He's chair of the World Psychiatric Association Presidential Working Group on Medical Students. He's member of WHO Rehabilitation Program, involved with number of prestigious research grants. He has played instrumental role with his colleagues in Pakistan regarding initiation of child and adolescent psychiatry fellowship. He has received several awards, honors for his work. He has co-directed the child and adolescent review courses internationally, served on various boards and committees at regional, national, and international level. So we are really thankful he has joined us today. Mental health, such a pertinent issue, especially in the context of epidemic of this COVID-19 pandemic, due to prolonged lockdown and travel restrictions worldwide. We would really like to hear from you on this important day. Thank you, Dr. Bakar.
Thank you so much, Dr. Fozia. That was pretty detailed explanation. So first of all, I think today I started my day with even with the trainees from Gulab Devi Hospital. And it is wonderful to end the day with so many friends and colleagues. Dr. Ali Madi Hashmi already mentioned. I see my dear friend and colleague, Professor Imtiaz Dogar, who's doing some amazing work in leading the PPS. Dr. Aisha, Mia, Dr. Nazi Shimran, Dr. Ali Madi Hashmi, Dr. Majib Shah, Dr. Zishan, Dr. Ahmad Rehan, Dr. Fozia. Especially wonderful to see Professor Bilkis. She is leader in internal medicine, but I have not seen anybody this much psychologically minded who is not psychiatrist. So welcome, Dr. Samreen. So many wonderful friends and colleagues. Just I think might be very pertinent to give one message, since theme of this year, World Mental Health Day, is mental health for all. And when we think about mental health for all, we think about age for children, adolescent, older age, all ages, whether it's gender, women, men, cultural, ethnicity, socioeconomic status. But I think for us, one thing to always remember, that we should take care of ourselves and all the health care professionals, whether it's mental health professionals, allied health professionals. And especially I want to say that all of us and our colleagues, that we should think about taking care of our medical students, all our trainees and nursing staff. They are our future and backbone of our profession. So it's important that we take good care of them. And it's great to see some of the applicants on this seminar. Wish you all the best while applying for residency. And thank you so much, PAPANA and PPS and everyone for organizing this and all the wonderful work you're doing. Thank you so much.
Thanks a lot, Dr. Bakar Azeem. It's always an honor to listen to you. Next on our agenda is Professor Dr. Nazi Shimran. I'm lucky during my current trip to Lahore, I was able to actually meet her in person, and she is even a better person and a better physician in person when you visit with her. So she is the Head and Professor of Department of Child and Family Psychiatry, King Edward Medical University and Mia Hospital. She is a fellow of Royal College of Psychiatry, and she has also done PhD. So I would like to welcome Dr. Nazish.
Can I just check if I'm audible? Yeah.
Yes.
Yeah. Okay. Thank you so much, Dr. Rehan, for inviting me, and thank you, PAPANA, for inviting me to be part of this really wonderful collaborative effort. And I hope this continues and expand in the years to come. Mental health की जब हम बात कर रहे हैं, so I think one thing which I always feel, particularly in Pakistan, that we are mostly focused on the treatment aspect rather than the health promotion and prevention aspect in all the specialities, let alone about mental health. So I personally believe that if we have very sort of high goals of having too many psychiatrists and too many specialists, even in the near future, that appears to be perhaps too ambitious. So in that, we have to see with whatever resources we have, how we can improve the mental health for all the population, starting from children and, as Dr. Bakar mentioned, for elderly as well. And on that, until and unless we focus more on preventive efforts and health promotion, we won't be able to change the landscape of Pakistan, just like in other low and middle income countries. And in that, I think as while working in UK and while working in Pakistan, there are a few things which are being done on the positive note, despite all the struggles and all the impact which we have seen. Like just recently in Islamabad, a pilot project is being launched on mental health psychosocial support in collaboration with UNICEF. That's the first time perhaps that at the government level, things are being taken, that there has been mental health impact. And that includes using digital media to the maximum. So there is, just like Dr. Bakar mentioned, there is one app which was going to be launched today. I'm not sure it is yet or not, about My Care. So that would be focusing specifically on healthcare professionals, how they can assess their own stress and give them some practical guidelines to manage that stress. So healthcare workers definitely have been very severely affected by the COVID-19. So that's one thing. Then Dr. Ali Hashmi also mentioned something which are happening at the Punjab level, collaboration with primary and secondary care. So while working on Well Women's Clinic, there will be screening of antenatal and postnatal depression. There has been some work being done on early child development, so how the mothers can be guided to work on that aspect. So that is a very positive sort of progress which we have seen. And another recent thing which has been happening is that there has been incorporation of school mental health aspect in the teachers training by the Quaid-e-Azam Academy, which looks after the teaching and the training needs of all the teachers in government sector hospitals in Punjab. So in that also 2 pilot projects have been started, one in Pindi and one will be in Lahore, to train the school teachers how they can they can sort of broaden apart from academic, focus on screening for child mental health issues, being more aware of the child issues, because we do know that majority of the psychiatric illnesses, they begin at a very younger age. So if we can work on improving our parenting skills, if we can collaborate with schools, task shifting approach can be used. If the teachers, they are in the best position to identify any early signs of any distress. So all these things would help in reducing the morbidity as well as the mortality of the psychiatric illnesses. And stigma is another aspect which do sort of prevent, even whatever help is available, prevention of access. So I think talking about it more, we as psychiatrists cannot do it alone. So we need to have more collaborators involved by our non-medical professionals, by our medical colleagues as well. So they can become our advocates in promoting the wellness concept rather than just talking about mental illness. And I think sort of there has been a lot of work done on the PPS forum, and we would continue to work and look forward to guidance from PAPANA as well. And Dr. Bakar Azeem has always been guiding us. So I think by working collaboratively on teaching, training, some other campaigns which would be helpful. So I think these are the few things which we need to focus on rather than just focusing on academic centers and tertiary care centers. So that's all from me. Thank you so much.
Thank you, Dr. Nazir. So great that we've all gathered here, and so exciting to hear from all of our speakers, each one of whom is a leader in the field, and the amazing work that they're all doing to further awareness, research, treatment, and resources, like really towards the goal of mental health for all. And on that note, it is my great pleasure to introduce one of my own mentors, Dr. Aisha Mia. She's the founder and CEO of Synapse, Pakistan Neuroscience Institute. Dr. Mia is a leader in the field of mental health with a trailblazing career in mental health with experience in teaching, mentorship, and developing various programs. She's a distinguished fellow of the American Academy of Child and Adolescent Psychiatry and also serves on the Global Mental Health Committee for ACAP. She's won numerous awards for the integral role she has played in pediatric mental health, and she's also been the past chair for the Department of Psychiatry and founding dean of students for the Office of Student Experience at Manal Khan University, Karachi, Pakistan. Dr. Mia.
Thank you so much, Kiran. Lovely to see you here. Big surprise. And Assalamu alaikum to everyone. It's like a lot of my very, very close and good, lovely friends are here. But I think I do want to take just a few seconds to really applaud our young and upcoming stars, Zishan, Ahmed Rehan, Kiran, Shimran, Fauzia. We're just kind of finding out, kuch ko main janti hu, others I keep finding out that these are these amazing, amazing people. Some may not be here, but I've been working with them through ACAP as well. And it's really happened, I think, in the past 5 years or so, that suddenly we have this new crop of very dynamic, very inspirational, very motivated, enthusiastic young people from Pakistan who've taken up these reins of adult and child mental health, and this gives me great hope. I think the future is good. और जो हम लोग थोड़ा sort of overwhelmed rahe hain in our sort of career कि ये इतने बड़े मसले का सिरा कहाँ से पकड़ें. I think that these young people have already have it under their hold, and I think that things will definitely look better and have already started to look better. Moving on from here and forward. Again, thank you for PAPANA, and great to see Bakar, Nazish, Professor Bilkis. मैंने chat में तो लिखा, but आप पहले भी हमारे 2-3 psychiatry के sessions में आ चुकी हैं, and it truly is very lovely to have a non-psychiatrist, physician, because I say this all the time कि हमारे अपने medical field में ही stigma इतना ज़्यादा है कि आगे तो बहुत दूर की बात है कि हम उसी में trying to get our own sort of physicians to see how mental health is just so important. So it's always very heartening to see our non-psychiatrist colleagues with us. So thank you for being here with us today. A lot of people have already said all the good things, all the right things. So I just want to reiterate a couple of things that Nazish has mentioned. I think from my perspective, मुझे पाकिस्तान वापस आए हुए कोई 8 साल हो गए, and I really sort of think that it's good for us to work downstream. हम हैं यहाँ पे, it's like जब psychiatric care की ज़रूरत होती है, तो yes, there are psychiatrists, there are child psychiatrists, but the extent of the pathology is so huge. I mean, 1 in 4, अगर आप conservative estimates ले तो 25%, some people give estimates of like 35, even 40%. That's like 100 million people. So ये downstream हम ये manage नहीं कर सकते हैं issues. I mean, it's the least effective use of our time. So trying to work upstream and trying to figure out कि issues क्या हैं, concerns क्या हैं that are causing this burgeoning sense of sort of mental health disorders or stress or anxiety or whatever that might be. I think that is probably the best use of our time, जिसमें हम parenting का भी सोच रहे हैं, school mental health का भी सोच रहे हैं. How can we have programs and interventions in sort of senior schools for our students, where we teach them or do some skill building and executive functioning in things like resilience and grit and collaboration and empathy and compassion. So I think that there's just a lot of work that needs to be done upstream, and uske liye, again, as Nazish mentioned, we have to collaborate, and we have to sort of convince even non-physicians that mental health doesn't just belong to us. Mental health belongs to all. Mental health belongs to our urban planners, जिन्होंने और sorry, I think we have.
I request everyone to please mute yourself. Thank you.
Thank you, Fazia. So, जिन्होंने like urban planners हैं, जिन्होंने हमारे cities को plan करना है, I think it's mental health belongs to them. Mental health belongs to our educators. Mental health belongs to our fashion designers, because when they are thinking about sort of new upcoming fashion, I mean, I'm seeing such a huge burgeoning increase in prevalence in eating disorders. This idea कि weight कैसा होता है and body image क्या होता है. So mental health, mental wellness belongs over there. So lawyers, it belongs to lawyers. So mental health and mental wellness really truly belongs to everyone. And I think that उसमें हमें लोग convince करने की ज़रूरत है कि ये सिर्फ हमारा काम नहीं है. We need to empower them, and we need to sort of make them feel that they also have a part to play in mental wellness, emotional wellness, and that piece for me is extremely important. And the only other two things, I mean, we've, Bakar's mentioned our medical students, our residents, medical students that are not going to become psychiatrists. How can we teach them? So mental health curricula in medical schools really should not be geared towards future psychiatrists. It should be geared towards all physicians, all graduating physicians who are not going to become psychiatrists. उनको कितनी mental health आनी चाहिए. So इस तरह की थोड़ी सी disruptive thinking जो कि already हो रही है. PPS is doing such a great job under Dr. Imtiaz Dogar. It's very obvious the shift that it's taken. So kudos to you, Dr. Imtiaz Dogar. I'm really excited by all the work that's been happening at PPS. And we keep, if we are to go on further, we need to keep thinking that way. And the only last thing that I think I'm going to say to all of the young people that are here, that तीन चीजें बहुत ज़रूरी हैं if you want to really do some transformational work in anything that you do, not just in psychiatry. One is being very true, sincere to your profession and to yourself. So integrity बहुत important है, sincerity and integrity. Respect for all the people, all the collaborators, everybody who's working with you. And the third, जिसका कोई भी I think नेमुल बदल नहीं है, कुछ वो नहीं है, is excellence. Excellence and competence. I think that as much as possible, keep learning. Make sure that you know the new stuff. Make sure that every patient encounter, everything that you're doing is your masterpiece. I think that piece is so important in terms of quality of what you do, and that once you are able to gain that kind of respect because of the competence you bring to your field, तो automatically फिर उस field की भी respect होनी शुरू हो जाती है amongst other peers. So that's all I would say. This sincerity, integrity, respect, and competence and excellence. Just hold on to that, and I think that we're looking at a lovely future ahead for mental health. Thank you so much.
Thank you so much, Dr. Aisha Khan. This is the first time I'm listening to you. I'm seeing you, meeting you, and it is excellent advices you have given. Thank you very much. Thank you. We are really privileged to have mentors like you. So with this, after Dr. Aisha Mia, I would like to invite Dr. Asif Khan. Dr. Khan is the Assistant Professor of Psychiatry at Central Michigan University College of Medicine, and he serves as the Associate Training Director. Dr. Khan has special interest in resident education and has developed several educational curricula for trainees. He is recipient of several Excellence in Teaching Awards and has mentored numerous residents and medical students. So on this day, I would like to invite him. Please welcome him.
Thank you, Dr. Narayan, for your kind words. Thank you for all the honorable guest speakers that we have from overseas, including Pakistan, and Dr. Azeem. Also, I would like to thank you, Dr. Arayan, for working tirelessly on arranging this in collaboration with Dr. Zishan and Ahmed Rehan on such a short notice. And particularly you're ill, and we're all praying for you. And I hope everything will be fine. Thank you for all the efforts that you guys are doing. I do not have much to add to already the things that has been said, according to the theme. I just want to make sure that I talk about the PAPANA's role in the mentorship program, and thanks to Dr. Manal Khan, Dr. Kiran, Dr. Apozia for their tireless work. And I have seen it, I have observed it. They're always active on our local groups, day and night. And it's so fascinating to see the enthusiasm and the sincerity in promoting these young applicants and making sure that they really achieve their goals and their dreams. So thank you for doing that. And I would just like to add that mentorship program, although is the focus of PAPANA for the last 2 years, our aim is to make sure that we promote PAPANA and make it visible not only nationally, but internationally. And this is why we are putting our heads together, we're meeting, and we are definitely trying to develop some strategies. I would also like to mention that with these endeavors, particularly with this meeting, we want to ensure and enforce our sincere effort that we are very sincerely interested in collaborating with PPS, and we'll always be there. If you guys need us. And lastly, I would like to mention, as a geriatric psychiatrist, I would like to advocate for geriatric mental health in Pakistan, and will be available for any help that is needed from the PAPANA platform. I wish you all a very happy Mental Health Day.
Thank you very much, Dr. Khan, for your kind words. And with this, thank you. I can see Manal Khan has joined us. Thank you, Manal. And I would like to invite Dr. Kiran Khalid for a short message.
Thank you, Dr. Fauzi. I think so many of our leaders have spoken, and it's been so great to hear them talk and to learn from them over the course of our own career. Just a few things that I just really want to echo and that resonate, I think, with where our field is going and should potentially go as well, is just this concept of like prevention and resilience. And how do we foster that in people who are younger and in people who are at risk and may not really be at the level of meeting like criteria for a disorder and dysfunction at that point. And I think really by building sort of resilience and these connections that we're making to start more programs, start collaboration in research, to provide more awareness to combat the stigma that really exists in the general population, but also exists in the field of medicine, like other speakers have said, I think is going to be so integral in really achieving the goal of mental health for all. And I think I really like the concept of what WHO says about health in general. It's not just the absence of disease, that it's not just that you're surviving and that you're able to combat a disease, but it's really the concept of wellness, that you're doing well, you're not just surviving, that you're thriving. And I think I'm so glad to hear the work that everybody is doing towards that goal, that at the end we can help our communities not just survive, but like also thrive. So thank you for all the work everybody is doing. And well, like everybody said, we'll probably be reaching out to all of you to help us with our mentorship program and mentor our up and coming applicants and residents and ECPs. Thank you.
I would like Dr. Manal Khan, to say a few words.
It will be really hard for me to say a few words just because I'm managing 2 children at this time as well. I just wanted to attend as an audience member, but I want to give a shout out to all the mentors who have been working tirelessly. I want to give a shout out to everyone who's on the call today, because if we go years back, mental health was not something that was attracting audiences. Mental health was not something that was attracting ideas and everything. And today we have a great group of folks who are here celebrating Mental Health Day. This in itself is such a huge accomplishment. And as others have been saying, that we need to go forward, we need to charge ahead, and we need to collaborate, because together we'll go further. So all excited to collaborate with psychiatrists in Pakistan and psychiatrists over here, and to continue to advocate for our patients, because they're really vulnerable and they need our support.
Manal, we'd love to see the kids.
It's a little just because I am feeding one of them, so I cannot.
No, psychiatrists here, so we love to see the kids. So
yes, whenever they're in a better condition, whenever they're in a better condition.
Done. Okay.
Yes, Dr. Zishan.
Thank you so much, Dr. Fawzia Rai, for, again, all the hard work and all the, the PAPANA team. No, I would like, I know we have so many great mentors and, leaders in the field today, and it will be unfair if we don't invite them. So I would really request, Dr. Bilkis Shabir, if she can share some words with us, and we really appreciate her time, her effort, and joining us today. So please honor us with some sharing your thoughts. Thank you. Yes, Dr. Thank you.
Yeah, Assalamu alaikum. Can you hear me?
Yes.
Well, I was not totally, absolutely not prepared for this. Actually, I was about to go to bed when I saw Professor Ali Madi Hashmi's Facebook. And the reason you see me, there are many reasons you see me on the psychiatric fora, but one of the reason is that I have very close friends who are psychiatrists, and two of them you can see on the screen. One is one I call my sister, Professor Shimran, and the other my brother, my big brother, that is Ali Hashmi. So this is how you often find me. But definitely, what I feel over the years and as I've progressed over my experience as an internist, what I found is that you cannot separate the psychological and the psychiatric component of the medical ailment from the management of the patients. So it's, I often wonder, it's often like the egg and the chicken. You don't know which comes first. So whether it's the diabetes which is coming first and adding to the stress, or is it the stress which is leading on to diabetes and many other illnesses. So this is what I've found over the years, and that is why this actually attracts me. And I find that, getting into the psychology of a patient helps not only the management, but also helps in making us understand, make them understand about their illnesses, and make them willing to comply with the treatment and to understand the disease better. So and whenever we
Dr. Bilkis, are you with
go
us?
to any, conferences or seminars. Yeah. Can you hear me?
Yes.
Yes.
Yeah. So whenever we are holding, I was saying, whenever we are holding CPCs and seminars and case management discussions, we always trouble these two friends of ours. The reason is that the psychiatric component of management is very important, whatever the disease is. This is what I believe in. There's just, and I believe in multidisciplinary approach in the true sense, and I think psychiatry component is a very important part of medical management. One thing which was, striking me, I was seeing this poster of which I think Dr. Fawzia created. It was a wonderful poster, and you had mentioned the theme of the World Mental Health Day for this year, and it was mental health in an unequal world. So I would request our very worthy and esteemed professors and Dr. Bakar and all the seniors, Dr. Aisha, or I mean whoever would like to understand and just explain to me what exactly do you mean when you say the unequal world in psychiatry. It was just bothering me what is the actual message behind this theme.
Dr. Aisha Mia, the mic is to you.
Oh, really? All right. So it's actually, I was quite delighted a few months ago when I actually saw this theme, Professor Blakey. It's really about the disparities, right? So when we talk about mental health in an unequal world, we are talking about socioeconomic differences. Like agar aap Pakistan mein bhi dekhein, I've talking about this, like, with everyone. I've started my own institute, and then very quickly in the first 3 or 4 months, my clinic is full of people who can afford care. And I'm so mindful of that, and they're also ill. So that's not the issue, that I shouldn't be. But the problem being that, very quickly, even access to healthcare is there's so much disparity around that, around socioeconomic status, around race, around ethnicity, around urban and rural living. So, it's like pretty much all just Karachi people coming to us, then what's happening to the sort of interior Sindh, the rural areas, how are they getting care? The climate disparities, gender disparities. So child and adolescent versus adults, children are not getting the care that they want to. So this year's theme truly is about, working and being mindful of the healthcare disparities within the mental health arena. And how is it that we can, and then ye to phir hum sirf Pakistan ki baat kar rahe hain, agar aap dekhein that my colleagues in Norway complain about they have such a small population. I think 20 se 30 million log hain, aur they say we only have 400 child psychiatrists, and they think that is an issue, and we're like, well, we are 100 million young people and we only have 7 or 8. So from that perspective, developed versus developing, usme kitne disparities, and so it is an unequal world where where health is concerned, but specifically around where mental health is concerned, just because of the significant disparities that exist all around us. And now again, because of the climate change as well, uski wajah se jo disparities health mein aur mental health mein aa rahi hain. So, people have been talking about that. And gender, that's a huge, big issue. That's a big problem, big thing, big theme that is being talked about. Even within mental health care, women do end up getting care later than, sort of a man would. So, again, it's about disparities and about an unequal world.
Well, Dr. Aisha, that's a very thoughtful theme, and I would say that goes out for all the specialties of medicine, whether it be women health, whether it be medicine, whether it be surgery, whether it be oncology, whether this holds true for almost all the sub branches of medicine.
And how now it's written that the pandemic has further made these disparities or bada ho gaya. There are countries that have had access to vaccine, and then of course we have not, there are countries that have not had the access to vaccine. So that's created a bigger chiasm in some ways.
And
thanks,
Dr. Bilkis,
Aisha
I
Mia.
would like to add that in the poster, this mental health in an unequal world, that is the theme going on right now globally. And this belongs to all. We added that because this is our, agenda. This is our goal, that we really want that somehow we can help our, back in our country, we can help those who really need mental health.
Yeah, well, thanks a lot, Dr. Bilkis, Dr. Aisha Mia, and Fawzia. I think everyone has made a really good point, especially the unequal world means the inequalities even in United States. We see that the lack of mental health facilities, or at least for African Americans, for Hispanic, for Asians as compared to Caucasian population, the percentage of those minority population seeking psychiatric help is way less than Caucasian people. And I think AP, American Psychiatric Association, and maybe perhaps Dr. Zishan can enlighten us, because he has been involved in a lot of those APA committees and whatnot. They have been working so hard, especially to increase the awareness of psychiatric illnesses and how to seek psychiatric care among African Americans. So I think, and I'm not sure, but I'm assuming that it is because of those efforts. This year, WHO actually has decided to name the theme that mental care in an unequal world. I think it's about a difference between haves and haves not. And I think Dr. Aisha Mia explained in a really good way that in country like Pakistan, which has a population of 220 million or even more than that, there are only, we can count on fingers how many FCPS or Royal College certified or American diplomats are there. Psychiatrists are catering the bigger cities like Karachi, Lahore, Islamabad, and we are not even talking about the smaller cities. When we were trying to invite people for this webinar, there were some people who did send me some questions. And I would like to thank all of those young psychiatry applicants who are with us today, Dr. Ali Evan, Dr. Sana Javed, Dr. Manal Khan, and so many more. So, and these are my questions, or just maybe point to ponder for all of us, especially for Pakistan Psychiatric Society. So one of the concern was regarding the legal punishment for suicide. So still, according to Pakistan law, if you commit a suicide and you are not successful, you survive. So they shall be punished with a simple imprisonment for a term, which may extend to 1 year, or with fine, or with both. So ISPE, I think we can maybe someone can enlighten us, because according to my information, the law still exists. That's number one. The number two thing, which a lot of us have been talking about, is the lack of medical student or lack of student mental health resources. I think King Edward Medical University, they have this Zainul Haq counseling program, which they have created in our SIMS. In my medical college, we have created that same SIM support group, but there is no official counselor, so in the United States, from preschool to high school, colleges, universities, all of them have mental health counselors, and multiple, not one, for the students, for anything. If they want to vent out, they want to get themselves checked. But in Pakistan, again, according to my information, it may not be updated or correct, we don't have any such things even in medical colleges. I know SIMS doesn't have one. We have psychiatry departments, they try their best, but we don't have a person specifically designated to that, number one. Two, we don't have any career counseling, specific designated career counseling department in our schools, in our high schools, in our universities, and especially medical universities. That's number two. Number three, when we were talking about the prescription medicines, that anyone can have access to them, and then even non-psychiatrist people can write the controlled substances. I think one thing which I found out was still, I'm not sure, but I think the DEA, the Drug Enforcement Authority in Pakistan, there is no chairman, chairwoman, chairperson of that authority. So when there is no one to enforce any law, how would we go about it? And last but not the least, over the past few years, I know personally, a lot of students from King Edward have committed suicide. Several months ago, or perhaps a year ago, a girl from SIMS, she committed suicide. And I'm mentioning these things because what feedback I got from the students from King Edward and Services was that whenever they tried to reach out to their faculty, especially the clinical, the surgery medicines, that if someone is having a psychiatric problem, they were not given any leeway. They were not given any margin. They were not given any. I would like to mention, so one of the anatomy demonstrator in a tertiary care in a medical college in Pakistan, I would not mention the name, said कि आजकल ये depression anxiety का लड़कियों ने fashion बना लिया है. तो इस तरह so that was very troublesome for me just to hear about that. So I would like all of my esteemed honorable guests to, if anyone want to comment about it, if we can do anything about it from, of course, Pakistan Psychiatric Society, and I'm sure that we are doing it, but just that we know that we are doing something. And in the end, I would also like to mention, I would like to invite, we are very fortunate that we have Dr. Noman Ashraf. He is residency program director in Joplin, Missouri, has been a wonderful mentor to all of us. Dr. Ashraf, I would request you to say a few words.
Ji, Assalamu alaikum. Can you hear me?
Yes.
Ji, first of all, I think it's very important you've organized this event. I think it's really, really important. And Ahmed, your thoughts were very good, very mature, very clear, and I love those. The point that you raised about the suicide and awareness and stigma and reaching out for help, and then people really recognizing, and I think that's the work we need to do. That's not just Pakistan. Here we have that trouble too. One way to tackle that would be if KE establishes some sort of, I think first of all, they need to probably do like we do grand rounds here on burnout wellness, then make like wellness committee, find out wellness champions, and then we can connect with them and we can share what are the things that we feel there are problems here in our culture. And I think they're going to be the same because issues of training are similar across the board. The way trainees are treated, some professors are very much detached from how trainees now are coming up. Probably the resilience has changed because, back then it was, if I did 72-hour call, you have to do the 72-hour call too. If I was able to do all this and take care of 20 patients on my call, you have to do that too. It's not true anymore. And that is the struggle I have all the time explaining to like my senior residents and my faculty. It's not the same. Maybe it's different culture, maybe it's different resilience, maybe we're dealing with a different generation. So we have to change our expectation. We need to learn about what are those micro injuries that we cause every day when the resident or intern is on the field and they're working, and then how we can heal them. So I think that's the work that needs to be done. It can start with a dialogue. It always starts with a dialogue. Some awareness has to be done on both sides. We need to involve our faculty. We need to tell them to be more empathic, try to get in the interns and residents' shoes, trainees' shoes, and then see what are the struggles they have. And once they reach out, I think at local level, all universities should have dedicated helplines for them and wellness center. But nationally, the government should have helplines where people can reach out and speak about it. We are working from different fronts to try to work on this issue globally, like through addiction, through mental health. We're trying to do mass media awareness campaign too, but I think all this needs to happen. All hands have to be on the deck. So I think that would be a good start. But I think it's a really good initiative. I love the idea we are having this conference, and I'm learning a lot. Thank you.
Thanks a lot, Dr. Ashraf. I would request any one of you, if you have any quick questions, any comments on the discussions we had, and after that, I would invite Dr. Zeeshan and Dr. Mujib Shad for the closing comments. But before that, if you have any questions,
yeah,
any
Ahmed, Dr.
comments.
Dr. Nazish. Yes, Dr. Doger.
Yes, Dr. Nazish.
जी डॉक्टर नाजिश पहले जवाब दे ले, फिर मैं देता हूं डॉक्टर अहमद के क्वेश्चंस का.
Thank you so much. I think Dr. Bakar would second me as well. The medical students की बात थी उस पे. I think I totally agree कि medical students are under a lot of stress, and we know various reasons जिसमें faculty का attitude does play unfortunately a major role. somehow अभी भी पाकिस्तान के मेजॉरिटी मेडिकल इंस्टीट्यूशन में बहुत हायरार्किकल सॉर्ट ऑफ सेटअप है, और स्पेशली अगर मैं देखूँ तो बेसिक साइंसेज में इन पर्टिकुलर, सो क्लिनिकल में अक्सर चीज़ें बहुत बेहतर हैं, बट मेडिकल कॉलेज में एंटर होते ही जो स्टूडेंट्स का एक्सपीरियंस होता है दैट इज़ अनफॉर्चुनेटली नॉट वेरी गुड। अभी हमने कोविड में ही 5 मेडिकल स्कूल्स का लास्ट ईयर सर्वे किया, डॉक्टर बकार वाज पार्ट ऑफ इट, and it was really shocking that 1 in 5 medical students among the 1100 from 5 medical colleges from Rahim Yar Khan to Lahore, they reported suicidal ideation. So that was really sort of high, and extreme level of anxiety and depression was seen. So again, ek to yahi cheez ke we don't sort of teach our adolescents the life skills training and at a year early age, or फिर जब medical college में they are very high achievers, especially those who come to KE 96-97% marks लेके आते हैं, but unfortunately many of them do not have that sort of life skills to deal with stress, with failures, with life and death, which do put them at more higher risk of psychiatric issues. अब उसमें जो है डॉक्टर बकार इज द चेयर ऑफ WPA मेडिकल जो वर्किंग ग्रुप ऑन मेडिकल स्टूडेंट्स है, प्रोफेसर अफजल जावेद इज द प्रेसिडेंट, एंड देयर हैव बीन लॉट्स ऑफ इनिशिएटिव जो उस फोरम के थ्रू भी किए हैं. We have developed a medical students well-being module on behalf of WPA by involving medical students from Pakistan as well as medical students from Canada, and that will be uploaded on the portal that is final within the next month. So there has been a lot of efforts going on to destigmatize medical talking about mental illnesses. At KE at least we've got Psychiatric Prescriptions, we've got Zen counseling program, which was developed following suicide of a student. So the friends got together. So there is peer counseling and sort of all these things we have seen in the last few years, 2-3 years at least, and with advocates like Professor Bilqis and so many others who are very helpful in the faculty, apart from the psychiatry faculty, who have really sort of brought about a somewhat of a shift, which I would say, regarding talking about mental illness, about students who are approaching for help. We have also drafted a students wellness draft, policy draft, because at the moment I'm not aware that many of the medical students do have it. From KE we have included medical students to make a draft, and that hopefully will be implemented by involving academic council. But talking about it, but I mean, it's a whole cultural shift which is needed. And in that, until and unless institute comes across with some policy that anyone who is struggling would not be penalized for seeking help, so people would not sort of access any help which is available. So I think things are moving in the right direction, but at a much slower pace, so much more needs to be done. And even day after tomorrow, we've got a poster competition by medical students about mental health. IFMSC is organizing, talking about medical student stress day after tomorrow. So things are moving, but I agree that a lot more needs to be done.
Yes,
Dr. Nazish.
जी थैंक यू डॉक्टर नाजिश जी. जो अहमद खान ने सुसाइड की बात की जी, उसमें भी लॉ पहले मेंटल हेल्थ ऑर्डिनेंस आता है फेडरल गवर्नमेंट का, उसमें सारी चीजें क्लियर हो गई थी. सुसाइड वाज कॉल फॉर हेल्प. फिर 18th अमेंडमेंट आ गई, वो जो हमारा बिल है वो मेंटल हेल्थ और बाकी हेल्थ भी प्रोविंशलाइज्ड हो गई. तो आप सूबों ने अपना अपना बिल पास कर लिया है, लेकिन अभी भी ऐसा उसमें कुछ लैकुनेज हैं रिलेटेड टू दिस वेरी सुसाइड इशू. लेकिन प्रैक्टिकली डॉक्टर अहमद हम देखते हैं तो सुसाइड पे किसी को पनिशमेंट होती नहीं है. लॉ हो भी तो उसकी इतनी इम्प्लीमेंटेशन नहीं है. वी हैवंट सीन एनीवन जहां कोई प्रॉब्लम ऐसी हुई और उनको कोई पनिशमेंट मिली हो. नोबडी हैज अप्रोच्ड अस और नाइदर वी हैव सीन. रादर हमारी ओपिनियन पे फोरेंसिक केसेस में कोर्ट्स मोस्ट ऑफ द टाइम दे कंप्लाई इन गुड वे. इंडिविजुअल केसेस वेरी कर सकते हैं. रिगार्डिंग मेडिकल स्टूडेंट, वो जो पहले वाला ऐसा लॉ वाला उसमें काम हो रहा है, मेरे ख्याल में लॉ लास्टली अप्रूव होने के करीब है. बाकी रह गया मेडिकल स्टूडेंट्स में थोड़ी ज़्यादा हमें रेजिलियंस बढ़ानी चाहिए. इंडिविजुअल वेरिएशन है, सारे डिपार्टमेंट्स एक तरह ट्रीट नहीं करते. अगर कोई बेसिक डिपार्टमेंट्स में 1-2 लोग कर भी लें तो बाकी लोग कुछ फैसिलिटेट भी कर देते हैं. प्लस वॉट एवर वी से एज ए साइकियाट्रिस्ट, एज मेंटल हेल्थ प्रोफेशनल्स ना, उसको यूजुअली मेजॉरिटी मेडिकल कॉलेजेस में कंप्लाई किया जाता है. एनी हो, मतलब ये कोई लॉ नहीं है, वेरिएबल है। सेकंड क्वेश्चन आपका बीच में मेरे ज़हन से निकल गया है, अगर आप रिपीट कर दें तो उसका भी आई ट्राई टू आंसर।
थैंक यू डॉक्टर डोगर। वो क्वेश्चन बेसिकली ये था कि एक डेजिग्नेटेड मेंटल हेल्थ काउंसलर फॉर स्टूडेंट्स starting from grassroots level and especially for medical students and career counseling.
जी थैंक यू। हाँ जी, करियर काउंसलिंग जैसे आप लोग भी काम कर रहे हैं, इंडिविजुअल यूनिवर्सिटीज में है और स्टूडेंट गाइडलाइन वाले भी काउंसलिंग वाले सेटअप बन रहे हैं। HEC की रिक्वायरमेंट है, यूनिवर्सिटीज मेडिकल यूनिवर्सिटीज हैव टू मेक देम अल्टीमेटली, प्रोसेस में है। और जैसे कोविड से रिलेटेड भी हेल्पलाइन चल रही है, पॉजिटिव लिविंग पे भी काम हो रहा है, लेकिन वो कंक्रीटली बहुत ज्यादा उतना नजर नहीं आ रहा, बट थिंग्स आर मूविंग फॉरवर्ड। रिगार्डिंग प्रेस्क्रिप्शन भी मेरे ज़हन में आ गया, आपने पूछा था, प्रेस्क्रिप्शन से रिलेटेड लॉज हैं, ये नहीं है कि है नहीं, कोई ड्रग इवैल्यूएशन वाले नहीं है हमारे, है ना, क्योंकि हेल्थ प्रोविंशियल सब्जेक्ट है। हर जिले में एक डिस्ट्रिक्ट हेल्थ अथॉरिटी है, उसके अंदर DDHOs काम करते हैं एंड दे हैव गॉट द ड्यूटी कि वो इन चीज़ों को चेक करें, इम्प्लीमेंटेशन ऑफ प्रैक्टिस एंड ऑल दैट, और वो रिपोर्ट करते हैं फिर पंजाब हेल्थ केयर कमीशन को, या अपने अपने सूबों में हेल्थ केयर कमीशन बने हुए हैं एंड दे हैव गॉट द अथॉरिटी फॉर पनिशमेंट। सम ऑफ देम दे आर पेनलाइज्ड, अदर्स जो है जैसे लॉ की इम्प्लीमेंटेशन वीक होती है थर्ड वर्ल्ड में, कि वो लोग अपने रिसोर्सेज इस्तेमाल करके ब्राइब देम एंड ऑल दैट, जो ड्रग इंस्पेक्टर्स एंड ऑल दैट होते हैं मैनेज कर लेते हैं, लेकिन लॉज हैं कि प्रेस्क्रिप्शन को रोका जा सकता है और क्लियर किया जा सकता है।
Thanks a lot, Dr. Imtiaz Dogar.
And Ahmed, I would just like to add a very quick comment to Dr. Nazish's thought process. I mean, it was a very good point. I would just like to add, working with the students and residents, of course, we cannot ignore faculty education also. And it's all over the world, actually. It's not only Pakistan, it's also in the US. I mean, if you deal with different specialties, even they don't have a lot of information about the psychiatry, the psychiatric resident education and mental health. So some kind of an educational series for the faculty, particularly in an academic centers to start off with, could be something that could move the needle a little bit. And also, I mean, what we lack, I mean, of course, in the US, there are systems and protocols that we have to follow as faculty, but accountability, I mean, accountability of the faculty would definitely help. So besides the student education and, I mean, boosting their confidence to talk about their mental health, we also have to focus on the faculty education piece.
Can I make one quick comment?
Yes, of course.
Yeah, just I totally agree, Dr. Asif, and I think one of the certificate course on medical teaching, you'll be surprised. I mean, we to talk about emotional intelligence or training teachers to be more aware of that and how to give constructive feedback. But Dr. Bilqis is leading that sort of certificate in medical teaching, but most of the applicants which we get are from the clinical sciences. So it's an uphill struggle. There are some very sort of approachable faculty members, both in clinical and basic sciences, and there are some who are very resistant to change, and I think that goes all around. So I think sort of, again, like focusing on the wellness champions in the faculty and using them from every sort of year would be one solution. And just one thing which regarding suicide, I totally agree. Just suicide ka criminal, just sort of last week, I'm working on some suicide related projects. And I was at a meeting with the emergency team. So we generally get at least 4 to 5 people with self-harm attempts on daily basis and presenting in no emergency. And it was regarding that if they are presenting, so they don't end up in psychiatry referrals and so on. So one of the things which mostly came up was because of that sort of medical legal case banega, so majority of the families, by law, every case needs to be medical legal if they are presenting with attempted suicide. But because of all that, कि medical legal case banega, police involved होगी और वो criminal event बन जाएगा, उसकी वजह से majority of the patients after immediate treatment, they leave against medical advice, and as a result, they don't get the psychiatric help or assessment which is needed, just because of that fear that they will be punished. So until and unless that got decriminalized, many of the help which is needed would not be availed.
Dr. Nazish, you made a very good point. Sorry, Dr. Dr. Noman,
Yeah,
you go
it's
ahead.
Dr. Ashraf. Yeah, I just wanted to ask her, what are the barriers for that decriminalization, and what can we do? Like from the US, we may be able to use Apna platform and other ways of advocacy. If you guys guide us, what are the hurdles? What is needed so we can do some advocacy work on that?
Well, I think Dr. Imtiaz Jogar perhaps would be in a better position to answer that कि PPS जब इस पे काम कर रही है तो जो barriers आ रहे हैं, but एक दो चीजें, एक तो ये कि religious point of view से many of the laws when they go, which are when they go to the Islamic Ideology Council एक है, तो कई चीजें जो हैं वहाँ पे भी जाके stuck हो जाती हैं because it's felt that suicide haram है इस्लाम में and so on. So that's one factor. दूसरा जो है मेंटल हेल्थ पे वैसे ही बात करने वाले और चैंपियंस विद इन द असेंबली और सेनेट पे बहुत ज़्यादा नहीं है, ऑल्दो थिंग्स हैव चेंज्ड. प्रेसिडेंट अलवी इज़ वेरी सॉर्ट ऑफ एक्टिव और वो यूथ मेंटल हेल्थ और मदर्स मेंटल हेल्थ पे उनका बहुत स्पेसिफिक फोकस है. सो वी हैव सीन सम पॉलिसी चेंज. लेकिन सिंध में आई नो लॉट ऑफ वर्क इज बीइंग डन क्योंकि सिंध में अ सेनेटर इज इन्वॉल्व्ड who is working on suicide or suicide related data and psychological autopsies being done to understand why it's happening. So until and unless those researches are done with evidence that mental illness is the cause, so all these things needs to come together for any law change. Lekin isme I think Dr. Imtiaz Jogar would be in better position apart from religious or Islamic ideology aspects say, or what are the other barriers?
जी डॉक्टर नाजिश, अगर मैं आपको ऐड करूं तो इमरजेंसी में कभी हमने नहीं देखा कि सुसाइड अटेम्प्ट वाले को पुलिस अरेस्ट करने आई हो. Nothing like that. All the people may like to escape themselves, but nobody comes over there. There is no such practical punishment. और जैसे डॉक्टर ने कहा क्या हम क्या कर सकते हैं, हमारे सारे पॉलिसी मेकर्स इस मुल्क में आप रहते हैं जी, वहाँ आते रहते हैं. You can raise voice, you can write letters to our law ministry and health related issues के बारे में उनको अगर आप लिखेंगे भी कहेंगे भी तो they'll take us on board. Further उसमें जरा speed up हो जाएगा काम को. Already they are working on law related to this, लेकिन law department वाले और लोग implement करने वाले के law किसी और से contrast ना हो, जैसे डॉक्टर नाजिर ने इस्लामिक आइडियोलॉजी को बताया या बाकी चीज़ों का, वो थोड़ा slow process है law making में. लेकिन ऐसी नहीं है कि कोई, मैंने जैसे प्रैक्टिकल आस्पेक्ट बताया कि nobody punishes such people. लेकिन क्लियर हो जाना चाहिए, ज़्यादा बेहतर है और लॉ में ज़्यादा. जी
इसी बात से point which Dr. Nazish made, if someone comes to an emergency room after a suicide attempt or gesture, और अगर उसको we want to admit him against his or her will, do we have the laws that we can admit someone against his or her will? Like in US, we can put them on a hold and commit them. Do we have any law or any even act we can use?
जी emergency holding है, psychiatrist के पास है. If emergency people they contact them, you can hold them for 24 hours and then written justification दे के onward आप कर सकते हैं. वो जो मेडिकल सर्जन या मेडिकल स्पेशलिस्ट वगैरह के पास मुझे एग्जैक्ट आइडिया नहीं है, शायद हो ना हो, लोग चले भी जाते हैं. लेकिन साइकियाट्रिस्ट अगर समझता है डेंजरस फॉर हिमसेल्फ और फॉर अदर्स, ही कैन होल्ड द पर्सन. और हमारे यहाँ वैसे मैं आपको एक बात बताऊं, फैमिली को अगर आप कन्विंस कर लें तो आपको लॉ यूज करने की इतनी जरूरत ही नहीं पड़ती. प्रैक्टिकल रियलिटीज ये है, प्रैग्मेटिज्म ये है कि पीपल दे डोंट गो. If you convince them, if you give them information, care in proper way, they get treatment from you.
Thanks a lot. That's a really good point.
Again, sort of, I totally agree, Dr. Imtiaz, कि until unless the family is on board, क्योंकि we don't have the resources कि आप hold कर भी लें तो hospital में हमारे पास ना उतना nursing staff है, ना उस तरह से guards हैं, या उस तरह का secure setup नहीं है. So majority even बहुत manic patients भी होते हैं. So their immediate family members are our sort of like co-workers in managing that patient. Isolation में it's not possible at all. So इसलिए until and unless family agrees तो law exist भी करता है लेकिन unfortunately implement नहीं हो पाता because of all these various reasons.
Thank you so much again for all those valuable thoughts. I know Professor Dr. Azeem have some comments to share.
Yeah. on a positive note, just want to say, I feel so much pride. I see 3 training directors from Pakistan in US who are training directors, Dr. Mujib Shad, Dr. Naman, and Dr. Asif. So I think it's a huge honor for all the Pakistanis that you are training directors, and I know there are a lot of other training directors. And some of you, I think, know, I had some conversations. I always thought, especially in US, there are 3 or 4 things which I think are very important as a Pakistani community among psychiatry. One is that how we can help our trainees to shine at the national and international level. Second thing is how our faculty move in academic ranks, become training directors, associate professors, and full professors. And thirdly, not the least, that how our folks in US and around the world go for elections at APA or ACAP. I think a lot of you know Dr. Afzal Javed is from Pakistan, and World Psychiatric Association is the biggest organization in the world, which is in 121 countries. So I think it's a huge honor and pride for all the Pakistanis that Dr. Afzal Javed is the president. So our faculty members I always try to inspire them to think on those lines, on those 3 lines when we are working with different colleagues. But it's great to see all our colleagues doing well. Thank you so much, Zishan.
Thank you so much. I would like, to be mindful about everyone's time. I know in Pakistan it's very late. I'm really grateful again. I don't know how many times I can say that we really appreciate, such a short notice at such a late evening in Pakistan. You all joined us. So thank you so much for all our respectable, host speaker and speakers from US and everyone, Dr. Professor, Dr. Imtiaz Dogar, Dr. Nazish, Dr. Azeem, Dr. Aisha Mia, Dr. Ali Madi Hashmi, Dr. Balkis, and everyone who were able to join. And also my cabinet, PAPANA cabinet, Dr. Fozia Rai, Dr. Ahmed Rehan, Dr. Kiran, Dr. Manal, and Dr. Asif Khan, along with other, the respected experts, Dr. Naman Ashraf, Dr. Sadiq Naveed, and so many, and all the participants, all the applicants. I'm glad everyone is able to join. We are really grateful. And I would just like to end by inviting our president, Dr. Mujib Shad, to have a closing remarks so that we can conclude and wish everyone good luck. Yes, Dr. Shad.
Thank you. Thank you very much, everyone. I think I just want to echo some of the beautiful words and advices and the problem identification process, which everybody has very elaboratively discussed over this. My request would be to make this annual kind of meeting that we should have on every year on the mental health day, and we should actually invite in future some of the other Pakistani psychiatric associations or organizations over the world. Like I was thinking just now that we could have involved the Pakistani Psychiatric Association. I think we need to expand our group, and I would just not to take any more time, but just would like to sum it up in a sentence or two, that I think this is a multi-pronged problem which we are facing in psychiatric management. And it does not just involve the care of the patients, but also taking care of the people who provide care, and also take care of the people who actually are being trained, and also of the people who belong to other specialties. Because based on my understanding, about 60% of the patients in primary care facilities have some kind of psychiatric issues, and I'm sure that the percentage is not that small across all other specialties. So I think if we don't adopt a holistic approach in treating body as a unit, not compartmentalizing it into mental health, medical health, or OBGYN health, or so forth, I think we are not going to achieve complete success. So my message is to increase collaboration, increase our efforts in taking care of our medical students, our residents, our trainees, our consultants, our physicians, in a very holistic way. Otherwise, the problem is going to remain there. So I'm willing to offer all my expertise and my cabinets on behalf of my cabinet and the people and the research committee chairs, that we will just ask us, and we will be really glad to provide our expertise if it can be helpful to anyone in Pakistan. And we would like to request the same from you. Thank you so much and have a great day.
Thank you so much, and Allah Hafiz.
Allah Hafiz.
Allah Hafiz.
Thank you, everyone.
Thank you, everyone.
Thank you, everyone. Allah Hafiz. Thank you.
Thank you.
Hafiz, thank you.
Zishan, can you please stop recording?
That's what I am.